As Olympic athletes go faster, higher, and farther, they take greater risks that can lead to more traumatic injury and overuse injuries. But modern science is helping athletes get better faster. Often their own motivation is a good chiropractor. But we need to have our own good chiropractor right here in Chattanooga, not in Sochi. So, you know, we've been watching the athletes and the things they go through, the things they put themselves through. Well, Dr. Nick Circolone and Julie Carr, a practitioner from Apple Physical Medicine and Rehabilitation, are here with us. So glad to have you both.
We always love being here.
We
Thank
love
you for having
you.
us.
And before we sat down for this interview, you were telling me that one thing the athletes really have going for them is they are just in such good physical shape, even when they have an injury, they do better.
It's amazing the times that these people get injured and the time it takes for them to rehab, that they're back doing the same activities that they were doing when they first injured themselves. You see a lot of athletes, especially skiing athletes, they'll tear an ACL and it's about a 9-month rehab and they're back on the slopes doing what they want to do because their preconditioned status prior to that injury was good, and then they get back to where they were and they still can compete at that level. Whereas normal people, if we keep ourselves in check and make sure that we're eating right, exercising right, and in good shape, if we have to have a surgery for something, if we've fallen on the ice, if we've done something simple like that, we can rehab it faster and get back to normal activities.
So there is another motivation to get in good shape and be in the best health you can possibly be, no matter how old you are.
Absolutely.
Okay. And we'll get back to you in a minute because we want to talk about the fact that you did work with Olympic athletes as well. But
yes.
Julie, what kinds of things are you seeing with patients that come in as far as comparing outcomes?
Well, I'll tell you, even now I've seen that people who are starting a little late have already had an injury, but when they do get, you know, reconditioned and things, then they make a faster recovery if they injure themselves a second time. So it's definitely beneficial to keep that conditioning up.
And watching these athletes with what they go through, you know, the landing on the ice in the skating, and this, you know, the landing on these huge jumps, they don't always make it. And you know, even if they're perfection in Sochi, they weren't perfection getting there. So they're dealing with all of these injuries as well.
It's amazing how much the body can take before you can once you injure it, and then how much injury it sustains, and how quickly it responds to the treatments and to surgeries.
And you all deal with not just chiropractic medicine, but also the rehabilitation.
Right. And we do, and you know, after Dr. Dooley died, we took up a little bit of that, but we really miss him.
A lot of people
really
don't know about this. So
yeah, Dr. Dooley passed away in October. He and I were together for 16 years, and had the practice together. So it's been tough, but we did a lot more rehab back then. But the rehab part, what's really interesting, is I have a patient who's probably 80 years old now, and all I told him to do was get on the stationary bike. He had severe back pain. I had him doing it twice a day, 15 minutes, and he's walking without the cane as much as possible. He's straighter, he's stronger, and he feels much better. And this was an athlete. He was a pitcher way back when, and then now he's getting back into just doing a little bit extra. So it doesn't take a lot to get back into shape.
And you wonder sometimes when you see these people and the things they go through, not just the Olympians, but anyone here who is exerting themselves physically, whether it's golf, tennis, football, whatever it is, the sports of their youth sometimes do come back to haunt them.
It does. I mean,
later.
there's a lot of degenerative changes that occur. But again, if we keep ourselves in shape, if we're motivated to stay in shape, I think those injuries can be less painful as time goes on.
Now, you brought an arm and a leg here.
Yeah.
We've been laughing about the arm and the leg.
We brought these, actually, you know, as complex as we are, we're still really fragile, but you know, in the Sochi especially, we see a lot of leg injuries, and we see a lot of, arm and hand injuries just from these falls that these people have been doing. And you know, to rehab something like this takes a long time. But again, these people are in shape, they do much better.
Sure, and we are looking at this, and you're right, we are pretty fragile. I mean, we don't feel like we're that fragile, but when you look at this, that's
what's interesting about it is in the lower extremity
around.
and the upper extremity, there are 30 bones. Just in these two. So
Yeah.
between the upper and the lower,
Yeah.
each leg and each arm have, well, arm and hand included, there's actually 30 bones.
So a lot can go wrong.
Yeah, absolutely. Especially with the skiers. What you'll see a lot of times is they'll damage in the ankle area and in the knee area when they tear these ligaments. So, and then the rehab is unbelievable for them.
Yeah. Well, let's let everybody know how they can get in touch with Dr. Nick and Julie, Apple Physical Medicine and Rehabilitation. You're right there on Shallowford Road, real handy. And a good way to find out more information is to your website, right? applerehabgroup.com. Thanks to both of you for being here with us.
Thank you so much, Cindy.
We're back with more right after this. We're going to have a dog, a big dog, right here when we come back.